Hello, I'm Dr. Inman. This is a miniature lecture on lacerations and how we treat them using the VOM and laser technologies. Lacerations in the dog, the cat, the horse, very common, particularly common in the horse who cut themselves up doing all kinds of things. The animal's presented with a laceration that may or may not need to be sewn up. Essentially, a lot of times it needs to be sewn up, particularly in equine, where they'll whack themselves open with huge gaping wounds. And so putting them back together again is not only going to be good as far as the animal's healing and function, rehabilitation, but also to keep infection from moving systemically and also to leave an ugly, disgusting scar if we just let it granulate in. So our approach is to go ahead and treat the animal as acutely and as quickly as we possibly can, just like any other laceration. The problem with the laceration, of course, it's going to cause pain, and it may or may not be associated with injury to the spinal cord. So eventually we're going to want to check these animals out with an adjusting device to make sure they haven't accumulated any spinal neurological interference, aka vertebral subluxation complex, and that's going to happen. However, right off the bat, we will handle the animal for shock as we need to, for pain as we need to, essentially get the animal stabilized, and then what we do is we put the animal under a light anesthetic or some sort of anesthetic, and then we'll actually sew the laceration back together again, or coapt it back together again with either skin glue or some steri strips or whatever, or a wrap or whatever it is that we need to take and put the thing back together again. But always what we'll endeavor to do is we'll treat the animal, of course, originally for pain, with pain frequencies 465, 25, 20.5, and 216, essentially. We'll treat it also for increasing blood supply right at the lesion. Let's say that there's a laceration in the leg, and we'll hit both of them. And we'll basically use frequencies for nerve supply, 9, 16, 42, 53, and also for blood supply, 300, 4, 300, 4, 100, and usually 216, and also, since we're dealing with connective tissue, for epithelial tissue, we'll hit the frequencies of 363 for skin, 20.5 for collagen and connective tissue, 784 for infection, and also we'll use the frequency of 230 for lymphatic drainage. All of these three sets of 4 frequencies will be used on a laceration for about 180 seconds apiece. We'll do that twice a day for 3 days, once a day for 3 days, and twice a week for 2 weeks. However, within the first week, this wound will be healed back to the point where we can probably take the sutures out, unless it's some stress point in the equine or in the animal. We can probably take the sutures out in a very short period of time. For instance, like 7 days as opposed to 10 or 14 days, essentially. And so in cosmetic lacerations or voluntary surgeries that we will make a laceration with scalpel blade, we ordinarily would take the sutures out on day 10, but when we laser them, we have to take the sutures out on day 7, otherwise we're going to end up with scarring like railroad tracks, if you will. So the laser will cause the animal to heal at least 30, if not 40% faster, and this is particularly important because during that first week, essentially, we're accelerating healing all the way around, regardless of what the laceration is or what the other injuries are, at a very, very rapid rate, almost twice as fast. This has been a lecture on acute laceration, essentially, in domestic animals and how we treat it. I'd have you go to the vomtech.com website and look at the basic technology and how we apply it, and also for frequency-specific laser therapy. Thank you, and have a great day.